Hi, I'm trying really hard to be prompt, so I'm watching the clock, waiting for it to be 12:30. And we're gonna start. It's pretty exciting. It was way better with the music, and I saw Danielle bop into it. What a choir. Oh my God, yes, this room is so quiet. It's like you were here for a wake. We're here for good stuff, so it's almost 12:30 and we're gonna get started. I'm going to forewarn you, the second show is going to be a lot better than the first show. Sorry. We're just going to see what happens this time and then we'll adjust for the next one. So thanks for being the guinea pigs. It's 12:30, so we're going to start. Hi, my name is Christine. I work at the SWOG SDMC. I'm one of the data coordinators that send you all your queries. You're welcome. Oh, yeah, you're welcome. Yay! But yes, exactly, because we're also the ones helping you to figure out how to do it the SWOG way, and we really enjoy that. I also supervise, so I always encourage people to reach out when there's any doubt, but also if you're not getting the service that you need, please let us know. We can fix it. So with that being said, Jessica handed you out an evaluation form. Everybody got one of those? Please make sure to fill it out and return it when you leave. And then if you're not sure where to go next, she also gave you another form that explains the other breakout sessions. So don't stay here for both. It's the same show. So unless nothing sinks in, then I guess you do you and stick around. If you have questions at any time, feel free to raise your hand. Jessica will come to you with a microphone. My deaf self will be able to hear your question, but more importantly, the audience on Zoom will be able to hear your questions. So if you have a question, raise your hand at any time. We're happy to stop the action and answer it. Same thing with those folks on Zoom. Put it in the chat. We have Liz monitoring that, so she will also announce your question via mic and we'll get all the answers you've ever wanted. So for now, we're going to get started. This should be fun. It's not personalized, so if you do all the wrong answers, no one's going to know it was you, so don't feel bad about it. Also, I'm going to let everyone know that these slides will be available after. So there's a lot of great information and a lot of sources, and there's going to be a lot of reading, I warn you. So bear with that, but there's going to be great information. If you get it wrong, well, you're going to learn something today, and if you get it all right, congratulations to you for knowing everything. So if you were at the meeting last night, you already did the poll everywhere. If not, you're going to want to take out your phone or connected device. Instructions to start is on the phone, you're going to send a text message. So instead of like saying mom cell, you're going to type in the 22333. And then for the message text, instead of hi mom, you're going to write Courtney will. And if you know Courtney, you know she spells her name with an E. There's no E. Leave the E off. Courtney will 940. Once you send that, it will send you a little message back. You click the link, you join in. I'm so untech savvy. Yesterday I blew it. And for the username, I put my own name in. That's not going to work. Once again, you're going to want to put the Courtney will 940 as the username, and it should connect you up to the screen that you will see shortly. So I try to say that really slowly to give everybody enough time to get connected, and I will gauge the room to see when people look confident that they've signed on, saying, all right, let's move it along. All right. Also, I've learned if you're having trouble, just ask the person next to you because they probably did it successfully. It's okay to feel inept. I do it all the time. All right, hopefully those folks joining on Zoom are also in. This room looks almost there. Almost there. I'll turn the music back on. All right. We're going to hope everybody's in. Those that showed up a little bit late, just ask your neighbor what to do. They'll help you out. So here's what's going to happen. We're going to ask you some questions. You're going to plug in what you think is the answer. And again, if you get it wrong, no one's going to know but you. So don't worry about it. This is how we learn. There are no trick questions. It really is just to review what you may have already learned at this meeting, or maybe things you should already know in your job. But trust me, with the regulatory focus this time, there's some really brainy questions in here. It's okay if you don't get it right. This is how we learn. And every slide's going to have sources on it. So if you want to do extra research, you can do that too. So who's ready to test their knowledge? We're seeing this live, so 2 people are already like, huh? So, but the good news is you got in, so you know, that's half the battle right there. So everybody's logging in their answers. Gonna see, you can see, and it's fun because it's real time too. So it looks like a few people are nervous. Please don't be nervous. No one's gonna know if you get it wrong. And there's no free text, unlike last night too. So all the answers are up on the screen. So it's gonna be a breeze. All right, let's get this party started, I say. True or false? Withdrawing consent to participate in a study means the patient withdraws consent to being followed and no further data needs to be submitted. Some of them will see your answers in real time, and then I'll be able to know who's right or who's wrong, and it's fun for me. Some will just kind of see halfway through. So you got a 50-50 shot here. As somebody working at the Data Operations Center, I know this answer. We do a lot of work with this. So, gonna give a second just for some last minute answers. It appears as though the overwhelming response is false, and won't you be excited to know that the answer is false? Read that sentence carefully. Withdrawing consent to participate in a study means the patient withdraws consent to being followed and no further data needs to be submitted. Not true. That means they no longer, it could mean they no longer wish to be treated per protocol. It could mean they no longer wish to be followed per protocol, or it could be both. And not only does you need to get that explicitly from the patient, that needs to be relayed to our office explicitly. If you just say, and we hear it all the time, patient withdrew consent, that's not enough for us and we need more information. Does that mean they're just coming off protocol? Does that mean they don't want to be followed or contacted? These are very different things, so be explicit in your answers. Withdrawing consent to participate in a study does not necessarily mean the patient also withdraws consent to be followed. This distinction must be clearly documented on the off-treatment notice or the follow-up form for pre-RAVE studies. For patients enrolled in studies on RAVE, the institution must contact the SWOG Data Operations Center to request the consent withdrawal form is added to the chart for the institution to complete. You can learn all about this and other fascinating items in SWOG policy number 30. Next question, true or false? Labs should be reported in the units your lab provides to ensure accuracy in reporting. All right. I like this. We're going to learn a lot on this slide. I like this. I like it when we have both answers being represented. Labs should be reported in the units your lab provides to ensure accuracy in reporting. Seems very logical to me. But I don't work in a lab. I don't work at a site. The answer is false. As a data coordinator, I knew this one too. I'm 2 for 2, feeling good about myself so far. Labs should be reported in the units that the SWOG form is requesting. Participating site staff are responsible for converting the laboratory result units prior to entering the data. All SWOG forms will clearly specify the expected unit, and most will provide an example, such as XX.X. If we're looking for a digit past the decimal point, we're going to put that out there. We're trying to make that as easy as possible. If you ever find that our forms aren't making it easy, let us know. We're happy to adjust forms. We want to make them user-friendly. We are not authorized, unfortunately, to make any assumptions or conversions to the lab result values that are reported. It seems very obvious when you report your platelets as 120. We know you mean 120,000. Unfortunately, we're making your patient ineligible, reversible, because you've reported a lab that doesn't meet eligibility criteria. If your institution does not have an LLN or a ULN for a required field, and we do hear this quite often, we suggest either consulting your internal staff or just Googling what the standard is. And I know that seems weird, but that's your option if your lab doesn't have one. Again, for the latecomers, if there's any questions at any time, please feel free to raise your hands or stick it in the chat if you're joining us via Zoom, and we can discuss things further. All right, for those of you 0 for 2, here's your big chance. Question 3, revision X was just distributed. Do I need to reconsent patients or patients on arm X Select the best answer. Is it A? Yes, patients must be reconsented for any revision that involves a substantive change to the consent document. B, if CRB is the IRB of record, then the patient notification and reconsent requirements are included in the amendment review application posted on CTSU at ctsu.org. Answer C, SWOG recommendations for patient notification and reconsent are included in the SWOG revision cover memo. If the study is CRB approved, these instructions will be the same instructions as those included in the CIRB amendment review form. Perhaps it's both B and C, or maybe it's E. A, B, and C are correct. That's a lot to read, a lot to take in. Let's see how you do. Everybody's favorite subject. You know, C had a lot of words. Normally in multiple choice, the longest one is usually the right one. I'm not saying that's the case this time, but you ever notice that? Okay. So we've got no love for A at all. Little B, little C, a whole lot of E. All right. The tension's killing me. Let's see the answer. It's D. Somebody felt really good about themselves there. I'm not going to point anybody out. I love it. All right. B and C are both correct. SWOG recommendations for whether to notify patients or reconsent are included in the SWOG revision cover memo on page 1. If notification is required, detailed instructions pertaining to which patients must be informed and including the notification deadline process and whether accrual must be suspended until the revised informed consent document is implemented will be included at the very end of the SWOG revision cover memorandum under headers, patient notification and use of consent addendum and regulatory instructions. If the study is CIRB approved, these instructions will be the same instructions as those included in the CIRB amendment review form. If you have questions, please don't contact the SDMC. Please contact protocols@swog.org. We've got deals for just about everything. And while SDMC is happy to answer any questions, we're also happy to pass that buck. I'm the queen of it. So when in doubt, just reach out and we've got somebody to help you out. Really quick, if you're wondering why I'm reading these slides, I've verified with my guru that is important for the audio and for future training purposes. So I know rule number 1 is don't read the slide. Otherwise, we can read the slide, but there's a reason for it, so bear with me. Moving on. Yay. What is the best thing about returning to work at your institution? There's been a lot of talk about remote working. So let's find out what you think is the best thing about returning. Is it not having your pets, partner, children interrupt conference calls? Is it B, having a desk again instead of working at the dining room table? Answer C, weaning yourself off of TikTok videos. And answer D, seeing old friends and coworkers again. I'll give you a chance to answer that. I don't know about you, but this is bringing back a flood of memories when we first started remotely and then how it, evolved over time. I started off on this teeny tiny sewing desk I didn't even know we owned. And there was no room for anything. And now I've got this raising desk and this fancy office chair and a drawer. It's really, really great. Okay, it looks like most people, I love remote work, but I got to tell you, I get it. Seeing some old friends and coworkers again, it's kind of nice just to see people or people that you're not related to or people that you don't have to take care of. It's really, really nice. So yes, I had to share workspace with my husband for 1 week in the very beginning of COVID. It was the longest week of my life. Anybody out there that lives and works with your partner, praise to you. I don't know how you do it. Holy cow. All right, we'll move on. See the winning. It's like you knew that was going to be the winner and how much they've changed too. You see how much some people have changed. You're like, wow, have I changed that much? Yeah. Okay, moving on. Rave recommends an SAE report for a grade 4 lymphocyte count decrease. This event does not meet any seriousness criteria, so what's the best course of action? Is it A, do not report as an SAE since it is not a serious event? B, report as an SAE because it is a grade 4 AE? C, consult the protocol to determine expedited reporting, or D, ask the SWOG auditors for clarification at the next audit. This is a tricky one. I'm going to let you know. Don't be sad if you miss it. This is why we're here. Trying to figure out which is the longest one. They're all kind of even. This one's tough. Okay, looks like we have an overwhelming response of C, consult the protocol to determine expedited reporting. You know, isn't that kind of always the answer, consult the protocol? You know, I think maybe that's a safe guess. But again, I'm not pretending like I know these answers. Oh, it was C. Yay, all right. That's always a good rule of thumb to consult the protocol. If you have any questions, again, don't contact us. Contact the ADR at swog.org. And then again, all of these slides have sources if you want to learn some more information or need some clarification. You guys did good on that one. Sorry, not you guys. You folks, you people, I don't know what to say, I'm sorry. You all did a very good job on that one. Okay, true or false, another 50-50. The CIRB unanticipated problem and or non-compliance worksheet asks, has the network group sponsor, the study chair, or a federal agency been notified of this incident, experience, or outcome? Please answer yes if information has been reported via EDC as part of routine reporting. This means that I must submit a non-compliant report to SWOG via electronic data capture for the study. True or false? Either the program's not working or people are stumped. Oh, there it is. Okay. Again, that's a big one to wrap your head around. All those words and nobody thinks it's true. Maybe there are trick questions. Wow. Okay, so nobody's saying true. Everybody thinks this is false. Well, that's fantastic. That's the first clean sweep we've had. Very, very well done, everybody. That is false. There is an electronic deviation reporting pilot program for S 2012 for all others. And by the way, that's my study. It just dawned on me. We're doing the pilot program for that, but I think there's only 2 patients registered. So anyway, if you're interested, hey, rare tumors, looking at you. For all other studies, there is no mechanism for reporting protocol deviations via RAVE or other means of electronic data capture. This includes protocol deviations that are not related to, resultant from the COVID-19 pandemic, deviations that meet the CRB's definition of unanticipated or serious noncompliance must be reported to SWOG via email at qamail@swog.org. And I think you've heard from both Laura and Elaine, both on that. They're so wonderful to work with. Please don't ever hesitate to reach out to them. If your site reported deviation to qamail@swog.org and the deviation report was acknowledged without requiring additional immediate action, then this fulfills the reporting requirements to the lead group, SWOG. There's no further requirement to report via the EDC to SWOG. Okay. No eyes are glazed over yet. That's really good. And there's still no questions, so we will move on. You are closing out a study and have leftover drug. What do you do with it? A, if another NCTN study is open that uses the same investigational agent, request transfer of the drug to that study. Otherwise, follow local institutional procedures for drug destruction and document accordingly. B, return the investigational agent to the supplier. C, follow local institutional procedures for drug destruction and document accordingly. D, the longest answer by far, so it must be true. Review section 3 of the protocol for drug accountability, transfer, return, or destruction instructions to determine how to proceed. If questions, contact the applicable contact information for investigational agent questions listed in the protocol, or E, contact the study chair to determine how to proceed. I'll let you answer. You shy folks standing in the back, there's plenty of room up front if you want a cushy chair. All right, so looks like everybody's defaulting to the really long answer, but there's still time for B to get some love. Nobody wants to just return it. Nobody wants to contact the SE. Good, avoid E. I'm just gonna let you know, spoiler alert, it's not E. Right. once again, you're on it. It's D, not because it's the longest answer, but because it's accurate. If you're not able to locate relevant drug accountability, return or destruction information in the current version of the SWOG protocol, section 3, then you can contact, if it's a CTAP held IND, PMB after hours at mail.nih.gov, and we've heard from their representative today, full of great information. If it's a SWOG held IND study, then the appropriate contact information for the drug distributor will be indicated in the protocol. If unable to locate that information in the protocol, contact protocols@swog.org. They're in our San Antonio office, and they can assist you. If you're unable to locate information or contact for questions pertaining to drug transfers on protocols conducted under a SWOG held IND, direct your questions to the QA mail distribution list. So section 3 of the SWOG protocol is the first and full answer. And then if you're not clear, then you've got lots of backup. Okay, what's the best thing about working remotely? And bless Deb for keeping these options very PG. I appreciate that. Is it A, having your pet on your lap during teleconferences? And I think we've all seen that. Is it B, no commute or parking fees? As a commuter, my vote is B. C, flexible work hours. Or D, every day is wear your pajamas to work day. And by pajamas, we could mean a lot of things. So I'm so grateful that Zoom is from here up. I get dressed every day, just not necessarily in work clothes. All right, so it looks like there are some pet lovers, and I'm sure you're cat lovers, because sometimes dogs are too big for the lap. No commuting or parking fees is huge. Again, I have a lengthy commute, so it's really nice not having to go anywhere. And then when you finally do have to go somewhere, it's like, my God, how do people forget to drive? And why is there so much traffic? And just like a 2-mile commute kills me now. I'm so spoiled. Flexible work hours for sure. But again, and I can only see the folks in the room, but I also notice the flexible work hours sometimes means you're working more. And I don't know if our employers realize that, but they're getting a lot more hours out of me at home, which I never would have expected. But it's so easy to just work later and say, oh, I'll just finish this email, or I'll just finish this chart. Next thing you know, you're off an hour ago. So anyway, and then every day is wear your pajamas to work day. That has a much smaller turnout than I expected. Are you guys not wearing heels right now? Because I don't miss this at all. And these are even short ones. Okay. So the working remotely definitely has a lot of perks. I should be seeing something cute pop up. Yeah, PJ up. So I should pop it up sooner, but I like the dramatic effect of Ralphie popping in at the end. Okay, true or false? On the AE report in RAVE, the column seriousness criteria required intervention is only applicable to protocols that involve a device. True or false? Looks like not many people are buying this. False is a runaway winner, and the answer is true. Well, not one gasp, nothing? That was shocking. That's as shocking as it's gonna get in here, folks. That was intense. All right, in newer SWOG trials that do not involve devices, this column is being removed from RAVE. You're welcome. In older studies where the column is still included, required intervention should be left blank, unchecked, if the trial does not involve a device. The 6 seriousness criteria for SWOG drug trials are death, life-threatening, hospitalization, at least or greater than 24 hours, persistent significant disability, congenital birth defect, or other used when no option fit well. If you have questions about this, please consult the ADR at SWOG.org. They can help you out with that. And again, you can also check out those sources. All right, let's turn this ship around. How do I know if the protocol falls under the old SAE reporting system, where SAE reporting should be done directly in CTEP errors, or the new reporting system, where the report is initially generated in RAVE and then completed in CTEP errors? Is it answer A? If you're unsure, start the report in CTEP errors. If the system does not allow you to complete the report, then it is using the newer reporting system and must be started in RAVE. B, if the protocol was activated in 2018 or later, then the report must first be generated in RAVE. C is the longest. Protocol Section 8 or Section 16.1 for older protocols will clearly state whether the protocol is using the RAVE CTEP errors integration and that sites must initiate all AEs in metadata RAVE. Or D, all of these are correct. Okay, we have nowhere to go but up because only one or two of you brainiacs got the last one. They should feel good about themselves. That was a tough one, so we're going to turn it around here. I had to laugh at A because I'm thinking, you know, in all your spare time, you're going to willingly do 2 different programs. Why not? I'm not surprised it's not getting any answers. Okay, so we're looking at C and all of them. Drum roll, please. Oh. C's running away. And why is C running away? Because it's the right answer. Nice work. Yes, congratulate yourself. That's totally allowed. Yes. If I was doing this at home, I'd be like, yes. And if I got it wrong, I'd be like, pfft. All right. So the best answer is to review protocol section 8 or section 16. Again, it's always consult the protocol. That's almost always going to be the answer. To determine how to proceed, as of April 1st, 2018, the CTEP errors reporting system began to exclusively utilize CTC AE version 5.0 for reporting SAEs. While this timing is somewhat linked to the changes in the RAVE CTEP errors integration and change in reporting process, the determination of whether the protocol utilizes the newer method of reporting was dependent upon the development process timing of the protocol. In addition, the fact sheet from CTSU identifies 3 additional ways to identify these trials: CTSU protocol specific webpage, metadata RAVE, and CTSU dashboard. If you have questions, once again, your friends at adr@swog.org are in your corner. You have entered a grade 3 urinary tract infection into RAVE. The patient was hospitalized for 48 hours. RAVE does not recommend an SAE report. So what is the best course of action? Do you consult the SWOG SAE coordinators at adr@swog.org? Do you not report as an SAE since RAVE did not recommend a report? Do you email the data coordinator for this protocol or email the study chair for this protocol? All right, let's see what you think. I'm a little torn on this one because people do reach out to the data coordinators. You know what we say? Did you look at the protocol? You should email adr@swog.org. So I'm going to guess the answer is, I'm going to hope the answer is not C. I'm going to hope. And again, everybody knows, don't bother the study chair. Just cut that step out. Okay, so we're looking at both A and B, but A seems to be running away with it. Let's see how we do. Boom. You guys are really getting this now. Excellent. You consult the SWOG SAE coordinators at adr@swog.org. Again, we talked about the protocol and how there's the table in that last question, I think. Sometimes it's not always clear, and especially when you have a form that's telling you, don't worry about it. You know, you get kind of comfortable and think I'm good. So when in doubt, always consult the experts. All AEs with hospitalization of at least 24 hours require the expedited reporting, as we previously said. If RAVE does not recommend an SAE report when one is necessary, or for other questions, contact the SWOG SAE coordinators at adr@swog.org for assistance. Still no questions, huh? All right. True or false? I forgot to mute my microphone during a conference call when I was multitasking. I have to laugh about this because I used to make fun of people that did that. I'm like, not a difficult concept. It's real easy to see when you're muted or not. Yeah, I did it not too long ago. So I was one of them. It's easier than I thought to do. I can't believe that there are people that haven't done it. Wow, kudos to you all. I'm not sure how you did that, but I see that I'm in very good company. Thank you for being my people, my kind of people. And now I show a lot more grace to other people now too when they do it. So it works out well. All right. How long does it take to receive site payments? Again, this is something maybe you don't handle in your institution, so this is a great learning opportunity. Payments are distributed, mailed to the site biannually at time of the SWOG group meeting, so that would make today payday. B, payments are generally distributed, mailed to the site quarterly on January 1st, April 1st, July 1st, and October 1st. It's all right, we're having a shift change, no big deal. Answer C, payments are generally mailed to the site within 1 to 3 months from the date of the payment trigger. Some payments may take longer depending on the funding source for a particular activity. Or D, payments are generally mailed shortly after the participating site invoices SWOG for activities. Place your bets. All right. Is it B? Is it C? Is it B? Is it C? All right. Solve the mystery. Team C for the win. And notice that dramatic, it almost bounced in B and you thought you stood a chance. And then it was like, no, it's C. C it is. If you have questions about any of this, or if you're missing any of your payments, please contact Kyle Tigey, and he's at our group chair's office in Portland. You can contact Debbie Allen, not that Debbie Allen, I say in my head every single time I say her name, for missing non-federal payments. And then again, contact Kyle for if your site is missing any federal payments for activity within the last 6 months. All right, good work on that one. I am a new CRA. How do I open study blah? A newly activated CIRB only study at our institution. Please select the best answer. We're going F this time. Holy cow. A, review protocol section 13 for CTSU site registration requirements and ensure that all regulatory requirements have been submitted to CTSU to obtain CTSU approved status for patient enrollment. We start talking fast because I don't know where we are time-wise. B, submit participating site study-specific worksheets, SSW, to CIRB for local context review of all unnecessary documents. I didn't mean on there. That was a Freudian slip. I'm sorry. Necessary documents. C, conduct local site initiation procedures, including but not limited to delegation of authority or online DTL as applicable to the protocol, training, local coverage analysis, assessment of treatment and patient workflows. D, schedule a site initiation visit with the SWOG protocols project manager and quality assurance auditor. Or maybe it's A, B, and C. Or maybe it's A, B, and D. What's it gonna be? Oh, I like it. I like it when we have divided answers. Oddly exciting to me. Okay. Look, every single one got representation. Makes me feel very warm. But we're moving on because the correct answer is A, B, and C, all correct. So the correct answer is E. For general questions pertaining to site registration status, contact the CTSU help desk at ctsucontact at, I always say Westat, but it's westat.com. It's really .com. Okay. Everybody's like, yeah, dummy. All right. Moving on. True or false? I can declare my patient has lost to follow-up on SWOG-led studies if last contact date for my patient has exceeded 2 years, documented at least 3 phone attempts to contact patient, and or certified letter to last known address has either been returned or not answered. Statistically speaking, every true-false question has been false. I'm not trying to lead the jury or anything, but it's a real runaway here. Everybody thinks this is true. And everybody is right. Nice work again. I like it when you don't get tripped up. To notify SDMC that you now have a patient has lost a follow-up and that they meet the criteria as such, use the Add Event tool on the subject summary page for studies that use RAVE. For pre-RAVE trials, exciting new news, by the way, in case you don't read the CRA newsletter yet, use the lost to follow-up form available on the CRA workbench under patient management, non-RAVE studies. After completion, this form should be emailed to our brand new DL you're seeing here first. Ooh, the excitement. SWOG lost follow-up at crab.org. We're getting more electronic by the day. Keep up. I love it. All right. True or false? I've forgotten to add a background screen on my camera and my coworker saw my messy home office. Oh my God, that person could not answer true fast enough. I love that response. I'm like, yup. I always get a little envious when I see people in their classy backgrounds and it's all tidy and like decorated. I just throw up those little things you can use, like pictures of stadiums and stuff. Like one time I thought my coworker like had the nicest house I'd ever seen. And then she said, no, it's just a filter. And it was like this really modern, sleek, white furniture and had a beautiful view. I don't even know what's real anymore. Okay, well, either you don't have a messy home office or you just have background screens. I like it. I like it. I fall under B for sure, but it's not that it was just our grandma chic decorating that we lack. So I don't like people seeing that we don't have style. So I'm a big fan of the screens. Okay, true or false? I can find information on payment amounts and instructions pertaining to funding and payment triggers for each study on the study-specific funding memorandum. True or false? You got a 50-50 shot here. Oh, wow, look at him go. Well, everybody thinks that's true. Let me tell you, I don't know, so I'm pretty excited. You know what happened last time? Oh, yeah, okay, we turned it around. That's good. That information is true. Payment amounts and instructions are listed on each individual study's funding memo. The funding memo for each study is available on the protocol abstract page of the CTSU website under the Funding Information tab. If you have general questions about the funding memo, contact protocols@swog.org. For questions about payment triggers, contact Pat Mize. For questions about federal payment information, you can contact Kyle Teige. And for questions about non-federal payment information, Debbie Allen, not that one. Okay. All right, true or false? We're in the home stretch, like minutes. The specimen tracking system, STS, should only be used to log and ship specimens for SWOG studies that are being sent to labs. If the specimens will not be sent to labs, they should not be entered into the system. I'm loving these results. This is another slide we're going to learn on one way or the other. Very exciting. Generally speaking, if no treatment was given, there shouldn't be a treatment date because an entered date implies treatment was given. Using that same logic here would be wrong. So SpecTrack is used for everything. Yes, fist pump. Yes, good for you. Because it should be used. Even if you're not submitting the specimens, you need to use the notify that specimen cannot be submitted link. This will resolve any expectations that are tied to it. It also notifies the lab that they're not going to be receiving it, and it covers your end for us. Also keep in mind that that may affect eligibility on some studies, but good news or bad news, it needs to be reported. Bring it. Uh-oh. Sorry, we're going to get the microphone for our at-home audience.
That last question was referring to all studies, or we're only talking about studies that wanted a specimen that you're not submitting?
So I didn't hear your full question, but it's going to refer to all studies because all current SWOG studies use SpecTrack. So you're always going to use SpecTrack either to log and ship your specimens or to notify they won't be submitted.
Okay, but if they're not requesting a submission?
If there's no specimens, then yeah.
Okay.
Yep.
All right, thank you.
Sure. Okay. Ooh. Who is affected? We're ending on a big one. Who is affected by the identity proofing and multi-factor authentication IP and MFA requirement ID.me? Select the best answer. Is it any person with a CTEP-IAM account and any system that uses CTEP-IAM credentials for login access is or will be affected? Anyone who logs into the SWOG CRI workbench is affected. Anyone who logs into the SWOG website is affected, or anyone who logs into the CTSU website is affected. Again, one answer, getting it all in the interest of time. You are correct. Excellent work. You've been paying attention at the earlier meetings. The updated authentication requirement applies to any person with a CTEP-IAM account and any system using those credentials, including all NCI CTEP CTSU systems, including RCR, CTM, SAIS, the CTSU website, OpenRave, and courses, CTEP airs, etc. All other systems, including the LPO websites that use CTEP-IAM for access, and all users, including NCI LPO contractor and site staff. True or false? I put a load of laundry during a work meeting. Now, if somebody says false and says they didn't do some laundry while they're, oh, you must not own a wash machine. Let's face it, we got things to do. Well, not all of us are as lucky as you. Liz is like, what if your partner does your laundry? Congratulations on your perfect relationship, Liz. We're all jealous. The helpful, she took a bow. The helpful reports in the old workbench have been split into these two categories: SWOG and non-SWOG patients, rave and pre-rave patients, English and Espanol, patient-related and study-related. This is something that we really went through in the spring group meeting. So if you weren't in attendance there, it's kind of a stab in the dark here. Also, if you're wondering, what is the CRA workbench? Please check out the CRA workbench. Just take a stab here. You're going to learn whether you want to or not, but CRA workbenches should be a very helpful, useful tool for you. All right, I know the answer to this. It is not the leading vote getter. The answer is D, patient-related and study-related. The CRA workbench had a little refresh last spring, so you'll want to take a visit to it and check it out. Did you say my time's up?
Yep.
My time is up. So let's just ask one last question. True or false? SWOG allows rounding of tumor measurements and lab values, because this is super important. True or false? SWOG allows rounding of tumor measurements and lab values. It's a runaway. Oh. Okay, we don't have time to prove that true is true. That's a fact. SWOG does allow that. It's in the best practices memo now. When rounding is used in reporting numerical digits on SWOG forms, it must be done to the nearest digit requested on the CRF. Whole or decimal, round up for 5 or higher and round down for less than 5. BTA and FUTA forms request target lesion measurements be reported in centimeters to the nearest tenth. If the scan report provides a measurement of 2.78 or 27.8 millimeters, it's acceptable to round the measurement as 2.8. Rounding is also allowed for any lab or test value related to eligibility unless otherwise noted in the protocol. If the patient's weight is 63.47 kilograms, for example, it should be entered as requested on the CRF, either at 63 or 63.5, not 63.4. Please remember to reference this slide. It's very important. And again, you can find that in the ORP manual and also the best practices. Oh, I'm really sorry. Sorry we didn't get through it all. I told you, you guys are the guinea pigs. See, if you came to the second session, we'd get through it all. If you want to run to the next room, then you can stay here. We'll do this. The quarterly SWOG CRA newsletter always has great information. I can find the newsletter archive on the SWOG CRA workbench under Tools, Resources, CRA Manual, or Training. And while you're answering, as you exit the room, Jessica is waiting for you. Make sure to give her your evaluation before you head to your next meeting. Everyone seems confident this answer is resources, and they are correct. Nice work. Thanks for learning and playing with us. Enjoy your next meeting. Remember, there's resources for anything you might need at SWOG. Thanks, guys. All right. So welcome. We're not quite as full this time. Something tells me people want lunch. So we're going to pretend there's a lot of you. I'm going to let you know we have online participants. So the point here is we're going to play along, a little bit of a game. We're going to test your knowledge and see what you've learned. Waiting for my clicker to click. And you're going to pull out your phone or your device, and we're going to do the pull everywhere feature. How you do it. All right, hold tight. Again, we have people joining us via Zoom as well that you can't see. You're going to be logging in. I'll show you how to do that in a second. And you're going to answer to the best of your ability. If you get it wrong, you're the only person that knows you got it wrong. It's not personalized. We don't know who's doing what. So the good news is if you get it wrong, you're going to learn. All slides have sources on them. So if you want to get additional information, this is how you join on your phone. You're going to send a text to Courtney Will, 940 is the text that you're sending, and you're going to send it to 22333. Once you do that, No. Once you do that, they're going to respond back. You're going to click the link. And then when it asks for a username, you're going to once again put the Courtney Will 940 in. And it should be up on your screen to pull everywhere. I think that's a great idea. And if it doesn't work, you'll let us know. Nothing. Okay, so if we could go next, get the instructions back on, one more click. And another click. There's a lot of clicking. All right. Okay. So. I know that it took a couple tries yesterday, so if it comes up presenter not found, just give it another shot. Again, you're texting the number 22333, and in the message text, you're putting Courtney Will, no E, 940. We just did this in the first session, so we learned a little bit. I was 3 slides short, and the second to last slide is my favorite slide, so we're going to go a little quicker this time. So just so you know, if I start reading fast, these slides will be available after the meeting, including the audio if you want it. So all this information will be available to you, so if you miss something and want more information, it shouldn't be a problem. All right. We're going to get started with the first question, just to make sure that you're up and running. If we could get next slide. You want to know who's ready to test their knowledge. This will be a great way for you to make sure that it's working for you. You'll get instantaneous results once you push A, I'm a little nervous, B, we are ready, C, huh, which a lot of people answered last time. I'm not sure about that one. And then D, of course we're ready to test our knowledge. Again, nobody knows if you get it wrong, and we're going to give you all the right answers. So moving on, let's start with our first question. True or false, withdrawing consent to participate in a study means the patient withdraws consent to being followed and no further data needs to be submitted. As I said before, I love it when both answers get love. That means someone's right, someone's wrong, and we're all gonna learn. We intentionally did no trick questions, but some of them are a little wordy and a lot to unwrap. So next slide. The answer is false. Next. If a patient withdraws consent after registration, the institution must determine with the patient whether they no longer wish to be treated per protocol, they no longer wish to be followed per protocol, or both. Withdrawing consent to participate in a study does not necessarily mean the patient also withdraws consent to being followed. This distinction must be clearly documented on the off-treatment notice or follow-up form for pre-RAVE studies. For patients enrolled on studies in RAVE, the institution must contact the SWOG Data Operations Center to request the consent withdrawal form is added to the chart for the institution to complete. I forgot to mention, my name is Christine. I'm sorry. I work at the SWOG SDMC. I'm a data coordinator there. That's who I am. So I'm very like SDMC side of it all, data coordinator side of it. I'm the data coordinator that sends you the queries. You're welcome. And we're the ones ready to train you and help you out any way that we can. Okay, and then also if you wonder why I'm reading the slides, it's for audio purpose. When we post the slides, there's going to be audio to them, so bear with me. If you have questions at any time, please raise your hand. Liz will come around with a mic so the at-home audience can hear you. So if you have a question, raise your hand. Those joining us via Zoom, please feel free to put your questions in the chat. Jessica is monitoring that, and we will answer questions at any time you have them. Okay, now the housework is done. Now we can move on. True or false, labs should be reported in the units your lab provides to ensure that there's accuracy in reporting them. I saw somebody grimace like they didn't know for sure what they should say, because it seems very logical. We like accuracy. The correct answer is false. Next slide, please. Labs must be reported in the unit specified on the SWOG case report form. Participating site staff are responsible for converting the laboratory result units prior to entering the data. All SWOG forms are going to specify the expected unit, and most of them provide an example of how it should be reported. Data coordinators are not authorized to make any assumptions or conversions to the laboratory result values that are reported. Patients will be made ineligible if lab values do not meet the eligibility requirements, even if it's clear. If you report your platelets as 120, we know you mean 120,000, but we can't assume anything. We'll make the patient ineligible, reversible. There's going to be an example of how it should be reported in those 6 digits. If your institution does not have either a lower or upper limit of normal for a required field, you cannot leave it blank. You need to provide what it is. If you don't have one, consult internal staff, or, as odd as it sounds, Google for a universal standard. We will need something and cannot make your patient eligible without it. Next slide. Yay! Thank you. Okay. Revision X was just distributed. Do I need to reconsent patients or patients on a particular arm? Select the best answer. Yes, patients must be reconsented for any revision that involves a substantive change to the consent document. B, if CRB is the IRB of record, then the patient notification and reconsent requirements are included in the amendment review application posted on CTSU. C, SWOG recommendations for patient notification and reconsent are included in the SWOG revision cover memo. If the study is CRB approved, these instructions will be the same instructions as those included in the CIRB amendment review form. D, B and C are correct, or E, A, B, and C are all correct. Please post your answers. We discussed in the last group that, going back to schooling, usually with tests, the longest answer is always the right answer. That may be true here, it may not be, but there might be a theme. All right, looks like a lot of people think that A, B, and C are all correct. Some people think just B and C are correct. B and C are correct. SWOG recommendations for whether to notify patients or reconsent are included in the SWOG revision cover memo on page 1. If notification is required, detailed instructions pertaining to which patients must be informed, and including the notification deadline process, and whether accrual must be suspended until the revised informed consent document is implemented, will be included at the very end of the SWOG revision cover memorandum under headers, patient notification and use of consent addendum, and regulatory instructions. If the study is CIRB approved, these instructions will be the same instructions as those included in the CIRB amendment review form. If you have any questions about any of this, don't worry, it's fine. You can contact protocols@swog.org and they'll help you out. What is the best thing about returning to work at your institution? Is it A, not having your pets, partner, children interrupt conference calls? B, having a desk again instead of working at the dining room table? Is it C, weaning yourself off of TikTok videos? Or D, seeing old friends and coworkers again? I'm going to tell you, in our last session, there was a runaway winner, and you are all matching that. The runaway winner was D, seeing old friends and coworkers again. Even if we don't think we enjoy our coworkers that much, it's amazing how much we can miss them, how much we can enjoy seeing people we're not related to, how much we can just enjoy people. I have a long commute. I never really liked going into work a whole lot. And then when I didn't go in and then I finally returned, I wrote on my whiteboard, I miss my coworkers in my office because I couldn't believe I was saying these things. So I documented it for posterity. It was fantastic. Then we also talked about how much people have changed in a couple of years when you don't see them. It's pretty crazy. All right, Ray recommends that an SAE report for a grade 4 lymphocyte count decrease. This event does not meet any seriousness criteria, so what's the best course of action? Is it A, do not report as an SAE since it is not a serious event? B, report as an SAE because it is a grade 4 AE? C, consult the protocol to determine expedited reporting? Or D, ask the SWOG auditors for clarification at the next audit? Let's see what you think. All right, it looks like most people are thinking that you should consult the protocol. As a data coordinator, I'm going to tell you that's always a good idea. The correct answer is C, consult the protocol to determine the expedited reporting. If you have any questions about this, contact our ADR team, adr@swog.org. True or false? The CIRB unanticipated problem and/or non-compliance worksheet asks, has the network group sponsor, the study chair, or a federal agency been notified of this incident, experience, or outcome? Please answer yes if information has been reported via EDC as part of routine reporting. This means that I must submit a non-compliance report to SWOG via EDC for this study. True or false? You're all very anxious to answer this one, I can see. It's a lot of words. And when you get into like CIRB and the compliance, it's tough to figure out. We'll let you off the hook, and the answer is false. There is an electronic deviation reporting pilot program for a new study. There's only, I realized last session, it's my study, and there's only a couple of patients. So it's very, very new, but it is the pilot program for it. For all other studies, there's no mechanism for reporting protocol deviations via RAVE or other means of EDC. This includes protocol deviations that are not related to or a result from the COVID-19 pandemic. Deviations that meet the CIRB's definition of unanticipated or serious noncompliance must be reported to SWOG via email to qamail@swog.org. If your site reported a deviation to QA-mail and the deviation report was acknowledged without requiring additional immediate action, then this fulfills the reporting requirements to the lead group, SWOG in this case. There's no further requirement to report via the EDC to SWOG. All right, you're closing out a study and have leftover drug. What do you do with it? If another NCTN study is open that uses the same investigational agent, request transfer of the drugs to that study. Otherwise, follow local institutional procedures for drug destruction and document accordingly. B, return the investigational agent to the supplier. C, follow local institutional procedures for drug destruction and document accordingly. D, the longest one, review section 3 of the protocol for drug accountability, transfer, return, or destruction instructions to determine how to proceed. If questions, contact the applicable contact information for investigational agent questions listed in the protocol. Or D, contact the study chair to determine how to proceed. Either you're very, very smart or you're defaulting to the longest answer. Either way, you're going to be right. Again, refer to the protocol. Section 3 is going to talk all about the drugs. If not able to locate relevant drug accountability, return or destruction information in the current version of the SWOG protocol in Section 3, then you can contact, if it's a CTAP held IND, PMB after hours. If it's a SWOG held IND study, appropriate contact information for the drug distributor will be indicated in the protocol. If you're unable to locate the distributor contact information in the protocol, contact protocols@swog.org. If you're unable to locate information or contacts for questions pertaining to drug transfers on protocols conducted under a SWOG held IND, then you can direct your questions to qamail@swog.org. We've got resources upon resources and backups to those resources. All right, let's talk about the best thing about working remotely. Is it A, having your pet on your lap during teleconferences? B, no commuter parking fees? C, flexible work hours? Or D, every day is wear your pajamas to work day? Again, in the first session, there was a runaway winner for this one. I'm curious to see how this group goes. I'm going to tell you, I don't think anybody in the first group answered D, which is crazy to me. So thank you for some of you representing. Not having to put on work clothes and heels is really, really nice. Well, and that's what we talk about. Zoom is from here up, thank goodness. So some clothing is just optional and I love it. But for me, it's definitely the commute. I have a long commute. So there's a lot of great things about working remotely for sure. True or false? On the AE report in RAVE, the column seriousness criteria required intervention is only applicable to protocols that involve a device. I'm going to tell you in the last round, Everybody answered the same, except for one person, I think. And guess what? They were all wrong. The answer is true. Nobody gasped. I thought they should have, because everyone got it wrong. It was crazy. In newer SWOG trials that do not involve devices, this column is being removed from RAVE, which is a great thing. In older studies where the column is still included, required intervention should be left blank or unchecked if the trial does not involve a device. The 6 seriousness criteria for SWOG drug trials are death, life-threatening, hospitalization of at least 24 hours, persistent significant disability, congenital or birth defect, and other, which is used when there's no options that fit well. If you have questions about this, please send them to adr@swog.org. Again, if you have any questions, feel free to ask them at any time and put them in the chat. How do I know the protocol falls under the old SAE reporting system where SAE reporting should be done directly in CTEP errors, or the new reporting system where the report is initially generated in RAVE and then completed in CTEP errors? If you're unsure, answer A, start the report in CTEP errors. If the system does not allow you to complete the report, then you know that it's using the newer reporting system, so why wouldn't you use your spare time to use 2 systems? Answer B, if the protocol was activated in 2018 or later, then the report must first be generated in RAVE. Answer C, again, the longest protocol section 8 or section 16.1 for older protocols will clearly state whether the protocol is using the RAVE CTEP errors integration and that sites must initiate all AEs and metadata RAVE. D, all of these are correct. All right, again, just so we don't miss any of the calls, I'm going to go a little quick. Correct answer is C. The best answer is to review Protocol Section 8 or 16.1 to determine how to proceed. As of April 1st, 2018, the CTEP errors reporting system began to exclusively utilize CTC AE version 5.0 for reporting SAEs. While this timing is somewhat linked to the changes in the RAVE CTEP errors integration and change in reporting processes, the determination of whether the protocol utilizes the newer method of reporting was dependent upon the development process timing of the protocol. In addition, the fact sheet from CTSU identifies 3 additional ways to identify these trials. 1, CTSU protocol-specific webpage, 2, metadata RAVE, and 3, CTSU dashboard. Any questions about these should be directed to adr@swog.org. You've entered a grade 3 UTI into RAVE. The patient was hospitalized for 48 hours. RAVE does not recommend an SAE report, so what is the best course of action? Consult the SWOG SAE coordinators at adr@swog.org. Do not report as an SAE since RAVE did not recommend a report. Email the DC for this protocol, or email the study chair for this protocol. Who do you reach out to? Okay. I love the fact that some people are saying reach out to the data coordinator. As a data coordinator and a part of the mentoring team, I tell everybody, when in doubt, reach out. We'll get you to the right place if we don't know. In this case, I'm saying, nope, you can consult the adr@swog.org. If you call us, we'll send you to them, but they are the experts in the situation. Also worth noting that all AEs with hospitalization of at least 24 hours requires expedited reporting across the board for SWOG trials. If RAVE does not recommend an SAE report when one is necessary, or if you have any other questions, contact the SWOG SAE coordinators at adr@swog.org for assistance. Okay, be honest now, please. You have forgotten to mute your microphone during a conference call when you were multitasking, true or false? In case my plead for honesty isn't clear, because a lot of people put false last time, and I'm like, how is that possible? I was telling them I used to make fun of people that did that, but then I recently did it, and I thought I was good about that. It's so easy to do. All right, how long does it take to receive site payments? Payments are distributed, mailed to the site biannually at time of the SWOG group meeting. B, payments are generally distributed, mailed to the site quarterly on January 1st, April Fool's Day, July 1st, and October 1st. Answer C, payments are generally mailed to the site within 1 to 3 months from the date of the payment trigger. Some payments may take longer depending on the funding source for a particular activity. Or answer D, payments are generally mailed shortly after the participating site invoices SWOG for activities. Now, maybe you don't work in the financials of your site, so this is just a great learning experience. No one believes we do it at the group meeting time. You're right. No one believes that they're invoicing. The correct answer is C, and we like that one because it almost looks like B was right. And so some of you felt good about yourself, but the answer was actually C. Contact Kyle Teige if your site has missing federal payments for activity past 6 months. Please contact Debbie Allen for missing non-federal payments, and their contact information is on there. Okay, so you're a new CRA. How do you open this study, a newly activated CIRB only study, at your institution? Review Protocol Section 13 for CTSU site registration requirements and ensure that all regulatory requirements have been submitted to CTSU to obtain CTSU approved status for patient enrollment. So consult the protocol. B, submit participating site study-specific worksheets to CIRB for local context review of all necessary documents. C, conduct local site initiation procedures, including but not limited to delegation of authority or online DTO as applicable to the protocol, training, local coverage analysis, assessment of treatment and patient workflows. D, schedule a site initiation visit with the SWOG protocol's project manager and quality assurance auditor. Maybe it's A, B, and C that are correct. Maybe it's A, B, and D that are correct. What say you? It's always tricky when they combine multiple right answers. You have to think it's one of them, right? So most people are thinking it's A, B, and C. Let's see. They are correct. Nice work. For general questions pertaining to site registration status, contact the CTSU help desk at ctsucontact@westat.com. Nice work on that one. True or false, I can declare my patient is lost to follow-up on SWOG-led study if the last contact date for my patient has exceeded 2 years, I've had documented at least 3 phone attempts to contact the patient, and or a certified letter to last known address has either been returned or not answered. True or false? The answer is true. Again, nice work there. To notify the SDMC that you now have a patient as lost to follow-up and that they meet the criteria as such, use the Add Event tool on the subject summary page for studies using RAVE. If it's a pre-RAVE trial, you're going to use the lost to follow-up form. It's available on the CRA workbench under patient management non-RAVE studies. This is new. After completion, this form should be emailed to our new distribution list of SWOG lost follow-up at crab.org. I think we talked about it in the CR newsletter that got published yesterday or today. So it's hot off the presses. There's a new DL for you to follow up with. True or false? I've forgotten to add a background screen on my camera and my coworker saw my messy home office. Again, we had a lot of people answer false to this, and I'm like, how do you manage that? I wish I had a classy background. I've been very impressed with some of my coworkers' homes, only to find out they were filters, but they were really, I'm like, wow. And it was a filter. All right, we got a little mixed response there. Oh yeah, once I figured out how to get those, I got The Office, I got Friends, I got Parks and Rec, I have like my favorite stadiums depending on the season. I love those things. I don't have a messy house, but I love those things. Oh, nice. Well, hey, let's use COVID to our benefit for sure. I'm all for it. True or false? I can find information on payment amounts and instructions pertaining to funding and payment triggers for each study on the study-specific funding memorandum. That's a lot of words. You can find information on payment amounts and instructions pertaining to funding and payment triggers for each study on the study-specific funding memorandum. Well, I hope this is true because that's the runaway winner. You guys got this. Payment amounts and instructions are listed on each individual study's funding memo. The funding memo for each study is available on the protocol abstract page of the CTSU website under the Funding Information tab. For general questions about the funding memorandum, please contact protocols@swog.org. Questions about payment triggers, contact Pat Mize. Questions about federal payment information, contact Kyle Teige. And for questions about non-federal payment information, please contact Debbie Allen. Again, all these slides will be made available. Bless you. True or false? The SpecTrack System should only be used to log and ship specimens for SWOG studies that are being sent to labs. If specimens will not be sent to labs, they should not be entered into the system. True or false? Hey, I love it when we have split answers because we're all going to learn something. Before anyone else gets it wrong, I'm going to tell you that is false. STS is used for both those specimens being submitted and those that are not being submitted. It's important to log specimens not being submitted in order to resolve expectations. Note this may affect eligibility on some studies. So we need no. I'm sorry, hold on. We're gonna have a mic so the home office can hear you and I can hear you.
So you mean for the ones not being submitted, or like if you can't get that specimen or there was something happened, it
For
got destroyed?
any
or messed
reason,
up?
yes, for any reason a specimen isn't being submitted, if you haven't used it, it's a free text field. You just select the specimen or specimens not being submitted, and then you provide a reason why. And that reason could be anything. We're not here to judge a reason. We just need to know that they're not going to be submitted. The lab will then know, SWOG will then know, and any expectations that may be tied to that will be resolved. Everybody's in the clear. And we don't, there isn't like an acceptable answer and a non-acceptable answer. Any answer will do, but if eligibility is tied to that specimen, it's going to be affected. Who is affected by the identity proofing and multi-factor authentication IP and MFA requirement ID me? Select the best answer. Any person with a CTEP IAM account and any system that uses CTEP IAM credentials for login access is or will be affected. Anyone who logs into the SWOG-CR workbench is affected. Anyone who logs into the SWOG website is affected. Anyone who logs into the CTSU website is affected. If you've attended any of OISHI, you should know this. The site operations, you'll know this. I mean, no pressure. It's okay to get it wrong. No one will know, just you. But it looks like you guys absolutely know the answer is A. The updated authentication requirement applies to any person with a CTEP IAM account and any system using the CTEP IAM credentials, including all NCI CTEP CTSU systems, including RCR, CTMB, AIS, the CTSU website, Open, Rave, NCORE, SIS, CTEP errors, etc. All other systems, including the LPO websites that use CTEP IAM for access, and all users, including NCI LPO contractor and site staff. All right. My terrible hearing made this way more entertaining last time. I have put a load of laundry in during a work meeting. What I thought I heard was someone said, what if your spouse, no, what if your partner does your laundry? And I'm like, what world do you live in? Because I want to change lives. That's not what was said, but and then just like this time when one person said false, I said, well, you just must not have on-site laundry services then, because I mean, who hasn't? I mean, laundry's got to get done. All right, the helpful reports in the old workbench have been split into these two categories. Is it SWOG and non-SWOG patients, Rave and pre-Rave patients, English and Espanol, patient-related and study-related? While you're answering, at the spring meeting, we had done a refresh of the SWOG-CRA workbench. So things have moved, things look a little bit differently. I encourage you to check it out. If you don't know what the SWOG-CRA workbench is, ouch, please check it out. It should be a very useful tool to you. And if it's not, we are open to suggestions and want to hear how we can make it more helpful to you. The correct answer is patient-related and study-related. Again, if you're not going to the CRA workbench, you're not going to know that. This is sort of a plant to make you curious and want to go to the CRA workbench. Again, we're open to feedback and encourage you to visit it. True or false, SWOG allows rounding of tumor measurement and lab values. Ooh, look at that, it's a dead heat. This is very exciting because the answer is true. And a lot of people don't know this, so I'm really glad it's in here. When rounding is used in reporting numerical digits on SWOG forms, it must be done to the nearest digit requested on the CRF, whole or decimal. Round up for 5 or higher and round down for 4 or less. Baseline tumor assessment and FUTA request target lesion measurements be reported in centimeters to the nearest tenth. If the scan report provides a measurement of 2.78 centimeters or 27.8 millimeters, it is acceptable to round the measurement as 2.8 centimeters. Rounding is also allowed for any lab or test value related to eligibility unless otherwise noted in the protocol. If the patient's weight is 63.47 kilograms, it should be entered as requested on the CRF, either as 63 or 63.5, not 63.4. You can see in the source that the ORP manual, chapter 16 will tell you this. It's also in the SWOG best practices memo as well. The quarterly SWOG CRA newsletter I just mentioned actually always has great information. I can find the newsletter archive on the SWOG CRA workbench under tools, resources, CRA manual, or training. It'll be interesting to see if people get this right. Wow, people seem confident. They're correct. That's fantastic. All right. I really had no faith in you. I'm sorry. I take it all back. Okay, yes, it's found under resources on the SWOG CRA workbench. And it really is a great newsletter. And we encourage people, if there's something you want to see in it, there's a link. You can tell us what you want to see. We'll happily do it. All right, my favorite question. AE assessment dates should fall within the cycle, with the final reporting date being A, after all treatment is received in the cycle, B, mid-cycle, C, at the end of the cycle, ideally day 1 of the next cycle prior to treatment, or is it both A and C? Please log your hopefully correct answers now. And I know I'm not giving everybody enough time to answer. I'm getting you the info though, and we're going to end on time. So the query I write more than any other query is AE should be assessed at the end of the cycle, ideally on day 1 of the next cycle. Please provide a more current AE assessment date. It's not mid-cycle. It's not when the treatment's done. It's at the end of the cycle. We need to make sure that these AEs are being attributed to the correct cycle of treatment. That should happen just before they get their next treatment. All right, what is the average number of times a week a coworker has reminded you that you were on mute when talking on a teleconference? Is it 1 to 2 times, 3 to 4 times, daily, or oh, for Pete's sake? My favorite is not when someone says you're on mute. It's when you're on mute, still muted, still on mute. It takes it that many times and how frustrated everybody gets, and I feel bad, but I laugh a lot too. Okay, not only did we got through them all, we got through them all with, I don't know, 2 minutes to kill. I don't want to brag, but now you've got time to roam the underground tunnels and explore the area. If you have any questions, we're happy to answer them. Again, you can still put them in the chat. Otherwise, this will all be available to you online, including audio eventually. The slides will come sooner. Other than that, enjoy the rest of your day and the rest of the conference, and thanks for joining us.